This could be a visit to the spa for a pedicure, maybe reflexology or a massage. But as Dr. Katia Langton applies 75 grams of pressure with a monofilament to Marcel's feet, pressure he can't feel, it becomes clear that this is more serious. Dr. Langton is attending to her patient here at Island Pedorthic Foot Care in Nanaimo. Marcel was diagnosed with type 2 diabetes about 20 years ago and recently lost 2 of his toes.
What happens is the blood sugars, the unmanaged blood sugars, damage the small blood vessels in the feet. And that in turn damages and kills off the nerve endings in the feet. And so you lose sensation, you lose protective sensation. And then without that protective sensation, without that gift of pain, pain is such a gift. When we lose it, we lose that loyal sentry warning us that we're at danger.
Dr. Langton used to work with pain as a chiropractor, but now she works with painlessness and has become an advocate for diabetic foot care. The feet are often the first part of the body affected by diabetes, and when you think about it, how often do you or anyone else actually examine your feet? Diabetics are assigned risk categories, and that categorization determines how often one should have a foot exam. But Dr. Langton says it's something all diabetics should be doing for themselves every day.
You know, is there redness? Is there swelling? Is there anything embedded in the foot? It's not uncommon. We had a patient that, was walking around on the hardwood floor and he kept hearing a tap, 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 and then he looked behind, there was a trail of blood, and so then he looked at his foot, there was a tack in it, but he had no idea.
Close your eyes again, Marcel.
Walking is so important, but if they can't walk because of pain or because they feel like they're doing further damage to their feet,
or they don't have a foot anymore,
or they don't, then they simply can't walk. Now they can't fight this disease and all the other lifestyle-related diseases.
We're looking for any calluses on the bottom of the foot.
2009 was a tipping point globally where lifestyle-related diseases, diabetes, heart disease, all those kind of diseases killed more people globally than infectious diseases. And that's our lifestyle. We can fight that.
Dr. Langton says keeping people on their feet is key to preventing unnecessary amputations. She's working with the Canadian Diabetes Association to bring education and awareness to both healthcare providers and patients. It was an instructor of Dr. Langton's that got her focused on diabetic foot care, a career path she is now following. He pointed out that the number of diabetic or pre-diabetic patients in the United States is almost equal to the entire population of Canada.
I went down to the Hanson's Hospital in Louisiana, known as leprosy, and trained there because that disease is very similar in the outcomes with diabetes in terms of the loss of sensation in the feet. So that's where I will be going into, more wound care and offloading.
Dr. Langton is very thorough with her information, from stressing the importance of the monofilament in a comprehensive diabetic foot exam to proper footwear and a healthy lifestyle, all with the objective of keeping people on their feet and reducing the need for amputations. She has a webinar available online through the Canadian Diabetes Association called Foot Care, a step towards good health. In Nanaimo, I'm Kait Burgan.